But I know we were talking about this system, right? This pediatric obstructive sleep apnea system that you all, I guess, are using. And so I'd love for you to speak about what that is and share with our listeners, because I think they're going to be excited to hear about this.
Yeah, so it was very exciting. It was introduced to us, I want to say about 2 years ago. So it's a system that comes out of Italy. So Dr. Alessandro Carafiello, he was trained kind of how I think we're all starting to learn how to train ourselves, where it's a full body dynamic of things. It's not just the teeth and the maxilla and the mandible. So he was trained, not only to evaluate the dentition, because he's an orthodontist there, but he was also trained as an MD. So he was trained to evaluate posture. He was trained to evaluate breathing. He was trained to evaluate kind of everything. And so in that training and working with the osteopathy doctors and things that he was working with, he came to realize there's just so much limitation to what we do orthodontically. We're just kind of focusing on these mechanical forces. We're strictly focusing on dentoalveolar forces. And so he came up with this system called the Nuvola system, whereby we can basically merge the constant orthodontic forces, those light forces that we're getting, and using it with a clear aligner system, actually. So some adaptations that he has in there, which I'll talk about with his aligner system. It's the similarity it has to other clear aligner systems is that it's clear, but basically the mechanisms by which it's made is completely different. Because what we're trying to do with this and the use of this, what we call freedom appliance, it's kind of similar to things like MyoBrace, right? So it's this prefabricated myofunctional appliance, but these clear aligners and this PMA or this myofunctional appliance are made to work together. And the way that they are made to work together and what they're attempting to do is essentially unraveling the entire cranial base. Because again, I know, as your listeners and your audience and yourself understand, is the bones of the skull are many, right? And when we're moving one single bone, we're obviously going to be affecting other bones, other sutures, right? Other areas of the skull. So it's how do we adapt our treatment beyond just looking at the teeth and the dentoalveolar forces, but how do we completely three-dimensionally unravel and basically establish normalcy or a lack of dysfunction in the entire cranial base? And so with that, kind of also promoting all these great cyclical forces essentially that we see, right? The cyclical forces of mastication, the cyclical forces of breathing, promoting proper respiration, which we know is only through the nose, right? Not through the mouth. And then how do we work with these myofunctional components, the muscles? And so it's the combination and the union of these two things together where we get this truly functional, dynamic orthodontic system that can be used in kids as young as 4, really is where they indicate that for, which is fantastic because again, we're getting entire proper function from a whole three-dimensional perspective, as opposed to just where are the teeth in space and do we have the proper measurement, from molar to molar. So it's just looking at all the dynamics of it.